Okay, this video is in regards to Unit 12, Part 1. I'm going to go over things relatively fast because this is a basic system that by now you've heard about and should know pretty well. Just give you a bit of context regarding it so we can get to the pathologies. One of the important things, and I think that we miss about systems, and I've said this time and time again, is the understanding as professionals why the system is built this way. Why is it working this way? Why is it adapting in a certain way? And it all goes back to survival. Yes, it all goes back to survival. The musculoskeletal system is vital. It is paramount. It's cardinal to survival. Why? Because it allows us to move. And movement means life. The lack of movement usually means that you are at a great disadvantage, to say the least. Movement allows us to hunt. Movement allows us to roam the earth and the areas and look for food. And movement allows us to protect ourselves and run. So the fight or flight uh, um, instinct response is definitely rooted in our ability to move. Um, this is a very important uh, um, super system because it includes more than one system that pertains to a certain goal, and we'll go over it. Of course, the book and the unit pertains to the more simpler um, pathologies. There are way more complex ones that are usually more genetic, but we're going to go over them pretty fast. The next thing that is very important about this system is the understanding that movement is created by tools, mechanical tools that we call levers. Levers are simple tools by definition that allow us to create movement of sorts. There are three basic levers uh, in the field of mechanics, and the body uses all three of them, but it uses one more than the other. 99% of the levers used in the body, of course, in relation to joints and movement, are ones that prefer speed over energetic efficiency. So, speed first, energetic efficiency later. I always teach and tell students, imagine, God forbid, that people are standing above your grave. Yes, I know it's not a nice thought. And what they say about you is, oh, that person was so energetically efficient. No, I'd rather be energetically inefficient and be alive and not have you guys standing above my grave. So the body has chosen to lose energy if it gives it the speed and the ability to move needed to survive. Very important. It's a choice. It's a choice made um, in the past, at several levels, and it exists in your body, and it means a lot. It means that we waste a lot of energy to be as fast as possible, not the fastest, but as fast as possible in order to survive. Very, very important. Okay, um, let's go over the injuries. I think that most of them are pretty simple to understand, so I'm just going to jump between them. We can start with slide 15, talking about fractures that you see. So you see in slide 16, sorry, no, 14, sorry, that these may include fractures, dislocations, sprains, and strains. Um, of course, fractures are the most serious of them all. The problem is that the damage, this system does not exist within a vacuum. There are multiple tissues around it, and there are multiple types of tissues connected to it. So the worst case scenario is, of course, additional damage to other tissues. Um, and of course, we can talk about the immune system needing to respond. Respond. We're talking about metabolic changes, and we're talking about tumor factors that might be activated or take advantage of the situation. So now on slide 15, let's talk about fractures. Um, so of course, a fracture is some kind of stoppage to the continuity of a bone at different levels. Um, of course, in order for a fracture to occur, the mechanical force applied to the bone has to be greater than what the bone can take. The delta between the two, the difference between the two, will be a major determinant of what kind of fracture you're going to have and how bad it is going to be. And of course, the angle or the nature of the force that is applied. Uh, Obviously, the location within the bone is going to affect it, and any factor that might influence what the bone is made of, to what extent, how healthy, and how durable is the bone to such mechanical forces. So we have four classifications, as you can see: open, closed, complete, and incomplete. Um, a complete bone fracture means that the bone is basically shattered, it's broken entirely. An incomplete fracture means that the bone um, has damage but is still in one piece. Okay? Um, when the skin is broken, when we have an opening to the environment, inviting any bad things in the environment to come in, which is obviously an immune issue, then the fracture is termed as open. Um, then we can classify the fractures according to the direction of the damage. That would include um, what we call a linear fracture, that the fracture is going parallel to the bone's log axis. We can talk about an oblique fracture, meaning that it is going, uh, um, sideways. It's going diagonally through the bone. Then we have a spiral fracture that just encircles the bone, and we have a transverse fracture that kind of cuts through the bone, and that, if it's complete, it's going to separate the bone into two pieces. Usually, hitting the bone at 90 degrees, sorry, of an angle. What else? We can divide the incomplete fractures into three. We have the green stick, we have the torus, and we have the bowing. They are very fractures, in general, are supposed to be more common in the weaker, so to speak, susceptible, predisposed populations, meaning children that haven't matured yet, the not psychologically, physiologically, and anatomically, physically, have not matured yet. And then, of course, those who are losing the ability to cope and regenerate their tissues, meaning the elderly, are more, the fractures of certain types are more common in those populations. Um, when we talk about the green stick fracture, we're talking about splinters to the spongy area of the bone. Um, and then what you see usually is a sharp bend to the bone. So if this is the bone and there's a fracture in the spongy bone, what you see is like a break. So you see like a splinter, and that looks like a green leaf. If you remember being a child, trying to break a green leaf that is still relatively flexible, it doesn't break at once. It kind of breaks in two, and then you have a part that is sticking out. So that's the green leaf fracture. Um, we're talking about the outer sources of the area surfaces of the bone being affected. The inner parts are not. So it's more on the outer crest of the bone. Then we have the torus fracture, um, talking about the creation of a buckle to the cortex, but it does not break it. So it's kind of like a dent. A Boeing fracture um, means that the force is applied to the longitudinal axis of the bone, and it creates like a bow. So instead of the bone being straight, it becomes a bit curved. Um, Usually, if you look at the joints, you have two adjacent bones. So one is absorbing the force, and the other is locking it in place. And that's why the force has nowhere to go, and it causes the the bone that is absorbing the force to get a bit of a bend. Um, let's see. We can also talk about pathological fractures, stress fractures, what we call transchondral uh, um, fractures. Um, if a fracture is caused because of a pre-existing pathology or condition, then it's what we call a pathological uh, fracture. It's basically like what we call the secondary disease or condition, right? There was an underlying reason for it to happen. Um, of course, the assumption is that if there's a pre-existing condition, that will cause the area to be weaker, and then the total force needed in order to create the fracture is lesser than if the area did not have any underlying negative conditions or factors aiding, so to speak, in a bad way, the fracture occurring. Um, of course, if you have a weak spot in the cortex of a bone, that is by far uh, the main cause that would weaken the bone and make it predisposed, so to speak, to such an injury. Not new to us, tumors, osteoporosis, infections, any metabolic problems will also weaken the area and affect the mechanical and chemical uh, um, context of the area and may be an underlying reason for a fracture. Of course, if the area is hit, so to speak, again and again and again, such as in contact sports, then the first hit might not cause the fracture. The second one might not cause the fracture. But the area is constantly being weakened until suddenly the fracture appears. Um, let's see. Of course, we can divide it into two, what we call fatigue fractures and fragility fractures. So we're obviously talking about an abnormal amount and repeated times of uh, applied force to an area, usually torque, um, that slowly causes the fracture or the area to be fatigued. So it's kind of nibbling in a sense, in a mechanical way. The forces are nibbling at the area until the fracture occurs. Um, Obviously, you expect the body to respond and be able to heal. But in this case, the healing process is slower and not up to par with the hurting process or the injury process. So although there are repair mechanisms and they are responding, they're not able to respond fast enough. So the balance is in favor in this case of an injury. What else? Then you have two different tissues with completely different responses to injury in the sense of what tools do they have and how fast it happens. That would be the difference between skeletal muscles and the bones. So they have a different schedule, so to speak, or response rate to injuries. And that means that the time until complete injury is longer. And it means that while one tissue can be healed faster, the other is not necessarily completely healed. Then when we talk about fragility, we're talking about a bone or a tissue that does not have, for any kind of reason, the maximal ability to cope with injury. They can coexist, of course, with any pathological injury or fracture. And of course, they are also secondary to some kind of cause that is affecting the bone. The third part, the third kind of type of fractures pertains to fragmentations and or separation of a portion of the articular cartilage. It can be in a single site or it can be in multiple sites. These fragments may include anything in the environment, the close environment that is affected. Mostly, obviously, it would be bone, cartilage, and cartilage. Those will be the two major components, but not only. And we see that these fractures are most common in adolescents. Adolescents are unique creations. Their metabolic rate is crazy, probably second only to a newborn. They experience periods and cycles of extreme hormonal influence and imbalance by definition in order to mature and grow. They are very active. They tend to be reckless. So that is one of the ages that definitely is the predisposed to such fractures. Then, if you remember, we have the direct and primary healing. The outcome of the injury, is very much dependent on the quality and the depth of the healing process. So we can have a full healing or a incomplete healing. We can have a perfect healing process. We can have a non-perfect, meaning that the bone might stay like this, for example, in theory. So it either heals beautifully and completely and perfectly or not. And of course, medicine can help with that to a certain extent. Of course, if a callus is created, that means that the healing was not the way we wanted it to be, and the bone is now weaker than it was before and has weak spots. Internal bleeding, the bone is supplied by blood. If the injury hits the blood vessels, that is of course a way worse injury and might affect the healing process because the blood includes all the factors that we need in order to heal. If you lose, of course, blood supply, then obviously the tissue, at least in the surrounding area, will die and will be weaker. Dead tissue You already know the answer to this. You know what's coming. Means inflammation, means a full immune response with all the pros and cons that you already know about. Of course, if it's an open wound, number one response, close the area. An open wound is an invitation for whatever's out there to come into the body and get it worse. So we want to avoid that as much as possible. In normal healing, the injured tissue is removed. New cells are supposed to be regenerated and replace it. But the bone might undergo what we call remodeling. So remodeling, exactly like in a house, is taking out things, bringing in things, moving them around, rearranging the area. Hopefully it's rearranged and the modeling leads to a better bone, or at least as good a bone that you had before. But that's not always the case, as we talked about. Scars, usually, if the healing is correct and the way we need it to be, you will not see scars in bones. Symptoms, obviously deformities. If we have non-perfect healing, the area can be swollen for a while. We can have muscle spasms that are influenced metabolically and mechanically. Obviously, if you're hurt, you might feel pain. By the way, regarding pain, pain is bad because it's a symptom that something is wrong. But pain is also good in the sense that it gives you an indication that the nerves in the area are still working. Because if you're paralyzed or your nerve lost its function, you won't feel pain. There's nothing to transmit pain. So that's a good thing in general, that the nervous system is not hurt that much. You might have impaired sensation for a while or indefinitely, and obviously decreased mobility of the area and decreased function, because mobility is function by definition. What else can we talk about? Sometimes pain is delayed. It's interesting. I always see movies where someone is shot, because movies today include a lot of people getting shot, obviously. And they immediately start yelling. That's not how it works in real life. There can be several minutes until you actually feel the pain, and it hits you at once. So being shot does not immediately lead to pain. Sometimes pain in certain areas of injuries is delayed, and you can see that it can be up to 20 minutes, which is a lot. I mean, you might think everything's okay, and you might walk on a limb that is actually fractured because you're not feeling pain yet. Obviously, that might make it worse. Then you might be asymptomatic until you try and move. Obviously, there's a risk in moving, but there's also an advantage. The advantage, which I don't advise you to try and use, is that you find out if you're hurt. The disadvantage is that by moving to find out if you're hurt, you might worsen the injury. Then when we're talking about immobilization, it can be a minimum usually of 12 weeks. Obviously, we try and mobilize people as soon as possible because it accelerates the healing process. Usually, it applies mechanical pressure to the bone, and according to the stimulus response principle, which you were taught about in the first week, it induces adaptation. In this case, it should be, in favor of our moving. But it's very important to get the right amount of immobilization versus mobilization, and the timing is crucial, and the physician's skills and knowledge are crucial in this case to not worsen the injury. You can still basically exercise as long as mechanical pressure is not applied to the area of the fracture during the time of healing. So that's even that is not a reason not to exercise, apparently. Um, let's see. Then we have the definition of non-union, meaning that the ends of the fractures have not met. Um, Usually, the bone will not grow together. It's not connected. That's a very, very bad situation to be in. You might have what we call what might develop is the gap is going to be closed by fibers, which is a type of scarring in that case. And in this case, it's also a type of coping mechanism that the body has. That is obviously not the best way to go about things, but that is what the body has to offer you. And in that case, you're creating a false joint because you have that space in between. It will be filled with fibers and fluids, and obviously it is going to be um, weaker than the original bone or joint. Then you have the delayed union. Uh, the union occurs, only that it takes longer. Um, we have the malunion, meaning that the bones, the parts are creating a union. They are connected, but not in the perfect way that we're talking that we would like. And once again, that creates a weakness. Dislocations and sublocations, pretty simple stuff. Um, both of them are due to trauma. Trauma is usually fast and powerful. Trauma does not describe something slow and mild. So it's some kind of sudden force applied, either external or internal. You can make a wrong movement, right? Or it can be applied to you from the outside, but it's a lot of force in very little time. Um, Both can lead also to fractures. So it doesn't have to end just at a dislocation or sublocation. Let's see. They can be, of course, the outcome of an underlying reason, meaning you were predisposed to such injuries. Um, this may include any one of the systems that is supposed to prevent that, such as our dynamic absorbers, meaning the muscles, um, any anatomical disfiguration, mistake during maturation and growth will obviously lead to an anatomical problem that may lead to a functional problem, as you well know. Of course, sports, especially contact sports, may lead to injuries of the sort. Let's see. So we have the hip, we have the knee, we have the shoulders that are very common areas where we'll see such injuries. The fingers, least likely to have dislocations and sublocations. And then we see that the symptoms may include those of a fracture uh, if they are accompanied by one, obviously. Once again, worst case scenario, the dislocation or the sublocation causes damage to surrounding tissues, and then according to the tissue and the extent of the damage, you're going to have to deal with those symptoms as well. Anytime you hurt a nerve, I'm talking about slide 37, you take the risk of paralysis, either permanent or temporary. Um, You might have a lack of sensation of pain, or you might have pain that is radiating to other areas of the body through the same nerve. Of course, if you are affecting blood, you are affecting oxygen supply and everything that we know by now that might be caused by ischemia, right? What else? Let's talk about injury to supporting structures. The supporting structures are mainly the tendons and the ligaments. Just a kind reminder, ligaments are supposed to limit motion to a certain extent, not completely usually, and tendons are supposed to connect the bone with the muscles and transition the forces from the muscle to the bone in order for a lever to be utilized. Without the tendon, in theory, you have a muscle floating somewhere and a bone somewhere, and you have absolutely no lever, and the whole idea of movement is canceled, eliminated. So without tendons, you have absolutely no movement, and they are built in a way to serve that need. Obviously, they're in close connection to both muscles and bone, so they are in the danger zone, so to speak, and it's not uncommon to have a tendon or a ligament injury when you have a fracture, a sublocation, or a location. Of course, extent of damage can be incomplete, it can be complete, it can be in different extents, it can be in different directions, in different locations, in multiple locations, and accordingly, the influence on movement will be accordingly. When we talk about a strain, we're talking about an incomplete tear, usually of the muscle or the tendon, or it's stretching. Stretching meaning that it might lose the elasticity either permanently or temporarily, and that will change its mechanical properties and its ability to help movement. A strain means that a major force was applied. When we talk about sprains, which sound similar but are not similar, we're usually talking about injury to a ligament rather than a tendon or a muscle. Then we can talk about an avulsion, which is the complete separation of the tendon or the ligament from the supporting structure. This will have to be operated upon. And of course, the higher the degree of damage or the extent of damage, the more likely you're going to need surgery and the longer the healing process is going to be. What else? Kind of the same idea between the relationship between the extent of damage to the healing process and the lack of mobility. Once more, inflammation as a response, hopefully being able to replace normal hurt or injured tissue with normal tissue. At first, we see that the order and formation of the new tissue is lacking. It takes time to organize the tissue, but the first principle is getting that area treated as fast as possible, even if it's not perfect. So first response is not the most effective, is not the most organized, hopefully not leading to tissue, to scar tissue, and being replaced as fast as possible with functional new tissue that is healing correctly. Let's see. Okay, then we can talk about inflammation of the tendon, tendonitis. Very simple idea. You have an inflammation in the tendon, it's going to hurt. It's going to hurt because there's no chance that you are moving without forces running through the tendon, and that causes an increase in mechanical pressure on the area and might um, at first delay healing, and later on with the stimulus response uh, um, principle increase the healing or help it. If the inflammation gets to the bursae, you have bursitis. Obviously, this hurts a lot because the bursae includes fluids, and as you know by now, or you should know by now, fluids cannot be condensed. You try and condense them in a closed area, they're going to push back, and it's going to hurt. Uh, Usually, at this point, you might have reduced tissue perfusion, meaning less oxygen, mechanical irritation, which obviously has to affect the nervous system. You might have crystal deposits that are very bad. Um, you have might have postural misalignment, of course, hypermobility in some cases might be the causes, meaning that you are hyperflexible. Um, of course, you can have a degenerative process that will uh, affect the bone density or the tissues, uh, you know, content, leading to changes in function, and that is what we call usually anything that adds with apathy, so a myopathy, a epicondylopathy, and so on and so forth. Let's see. I don't want to repeat the same mechanisms again and again. We see in regards to the bursae that it's outside of the joint by definition, so it rarely affects the joint itself or its movements, but it's still gonna hurt. You can see the normal or common phrases and terms usually used: acute bursitis, meaning it's not chronic yet or at all; chronic, meaning it's a constant imbalance. We can talk about septic bursitis, meaning that you have a certain level of infection and it might spread to the body, of course. Okay, muscle strains. Nothing much new here. It's a strain. In this case, it's injuring your muscles. Of course, this is problematic from a survival standpoint, whereas muscles are crucial to levers that are crucial to movement and survival. Of course, they are as well trauma-based. Muscle tissue heals slower and sometimes worse than bone, so definitely uh, problematic. It's not that they don't heal, but they don't tend to heal as fast or as good as bones. Of course, then you can have different extents and locations and depths of injury. They can be acute or chronic. You will suffer inflammation, bleeding, um, usually extreme pain. I've heard people in the past say "Oh, I tore a muscle," and the first question that I ask them, "How hard were you screaming?" And when they tell me I didn't scream, I'm like, "You did not tore a muscle." When you tear a muscle, You are screaming and you are finding out if you love your mother or your father more. The name of the parent that you scream is the one that you probably love the most. I don't suggest that you tear a muscle just to find that out, but you know, it happens. Um, let's see. Then we need the muscle to be completely protected for 6 weeks at least. Um, and then we can talk about late complications, meaning that things can go wrong. Um, so we can talk about myositis, which is obviously inflammation of the muscle. It's also termed heterotrophic ossification, or OH. It's idiopathic, meaning we don't know the mechanism. We believe that it's because of the inability of the cells to differentiate and help with the healing process. What else? Nothing new in regards to the principles that we're talking about: healing, extent of injury, mobility, and so on. Rhabdomyolysis. Unfortunately, I have a lot of experience from my military service with seeing rhabdomyolysis develop and get worsened. Even after you've identified it, I have unfortunately experienced as an exercise physiologist in the military with seeing how bad treatment can be, how it can be mistreated, and the horrible results of rhabdomyolysis. Rhabdomyolysis is a severe condition, an advanced level of muscle breakdown. It causes the overload of the kidneys, meaning that now you're taking the problem, so to speak, and it's not isolated in your muscles anymore. It is overloading the immune system. It can make the kidneys crash, and very, very fast. Although it's not the only condition to change the color of urine, I want to teach you something. It is better to rush someone to the ER and have to apologize for making a mistake in diagnosis than to have to bury them. Rhabdomyolysis can lead to death within 4 hours if it's untreated and if it's severe. Of course, there are different levels of rhabdomyolysis. Rhabdomyolysis is a pathology. We're not talking about the normal breakdown of alanine in order to create ATP because you've been fasting. That's not what we're talking about. And the muscles are very unique tissues. But when you break them down, you also get unique components that are not easy to deal with. The muscle includes a lot of hardcore components that are not easy to deal with, that you don't want spilled into the environment, from calcium that we've talked about to furin, two very reactive components, all sitting in the muscle, ammonia, you name it. You're talking about the wrong tissue to spill its content into the area, and you're going to pay for it. Of course, you are hurting the muscle, so or not you, but the muscle is injured metabolically, and you're losing perfusion, you're losing oxygen, hemoglobin, all the good stuff that lead to the worst pathology. So it's not going to stay localized at the muscle. Rhabdomyolysis starts in the muscle, most likely, and immediately starts affecting the whole body. It is a serious condition, and one of the distinctive ways to know or estimate if someone has rhabdomyolysis is the color of their urine. The more dark the urine is, the faster they better get to the hospital. And I mean right now. Leave everything you're doing, take the person or yourself to the hospital immediately. It's better to not drive if you're the person that you believe has rhabdomyolysis, obviously. Um, then we have compartment syndrome, which is a bit different. Compartment syndrome is affected by mechanical pressure. It can accompany any wound, any injury, and it means that the area, the compartment, so to speak, is experiencing increased mechanical pressure that is just crushing everything. Compartment syndrome is fatal. Obviously, uh, or unfortunately misdiagnosed a lot of times. The symptoms can be confused with rhabdomyolysis, and it often is the misdiagnosis of it, and it can lead to death. It can lead to the need to amputate the limb or the area where the mechanical force is simply crushing the area. Um, you would need a lab for this or have to have some kind of way to measure this, but basically one of the hallmark signs is the decrease of 200 grams of muscle uh, in order to affect hemoglobin and oxygen utilization, and that is what we call critical mass, meaning that that is the threshold from a mass standpoint to where you'll see oxygen starting to decrease rapidly. Of course, you're losing electrolytes, you're influencing the body at the cellular level because of the ion pumps, and of course the nervous system. Um, kind of talk about compartment pressure. You have an increase of mass and mechanical forces within a small area that is by definition increasing the pressure in the area, and it's not going to work um, in your favor. Severe burns, bleeding, disorder, any crush injuries are going to, any animal bites uh, may increase the pressure on the area. It's just a cascade of unfortunate reactions, whereas multiple systems in a confined area are trying to set things right, but they're actually uh, overreacting or not reacting in the right way, and they're actually contributing to a negative process um, that just includes pressure being elevated, and every tissue has a threshold of pressure that it won't be able to withstand. Um, we can talk about MH, malignant hyperthermia. It's an inherited muscle disorder, meaning the mechanism is genetic. Um, it's causing a hypermetabolic reaction to certain uh, anesthetics. Um, as a result, calcium is released from the SR. Allow me to stop, although I'm willing to bet that you already know what I'm going to say. The last thing, or one of the last things, there's many last things that you don't want happening, but one of the last things that you don't want happening, trust me, is calcium on the loose. You don't want it. Bad idea, bad idea. And what I just told you that is happening is that calcium is on the loose, and nonetheless, it's released from the SR. The SR has tons of calcium. Um, so not a good prognosis, not at all. It's going to affect multiple systems in the worst way, and it can lead to death. Calcium can kill you relatively fast. Okay. Um, then you see on slide what is it, 66, that although it hasn't been tightly proven as an actual direct cause, young males with a background of respiratory problems or acidosis, sinus tachycardia, masseter muscle spasms, and elevated body temperatures seem to be at risk. Then we can talk about bone disorders. I'm going to go through it pretty fast because the idea, I think, is pretty simple, and keep it simple, by the way. We're talking about imbalances. We're talking about processes where there's an imbalance for the worse. These are usually metabolic abnormalities that lead to structural abnormalities and biochemical abnormal reactions. It can be genetic, it can be epigenetic, meaning genetic because of reasons that are rooted in your DNA or RNA, or epigenetics that are reasons mostly of the environment, but definitely not because of DNA or RNA. So you've heard about osteoporosis. Osteoporosis is a process where the balance of destroying bone and creating new bone is the balance is lost. In this case, it's creating a process where the bone is becoming thinner and full of holes. Obviously, this could be silent for a very long time. It can be silent for decades, meaning asymptomatic. So the amount of tissue absorbed versus created is greater in the case of absorbed. It usually takes a lot of time to develop. Obviously, it can be secondary to a genetic disorder, it can be secondary to lifestyle, it can be secondary to multiple reasons that would affect the bone. At some point, the bone becomes so weak that it just cracks under the pressure. Just remember that what's keeping you up and upright, vertical, what's carrying almost the full weight of your body, minus the bones themselves, are the bones, are your skeletal. So they're constantly carrying a load, and they're constantly being influenced by mechanical forces. And when they become too weak, they break. Then you can see on slide 72 the criteria in the second bullet to be defined as osteoporosis. And I suggest kindly that you remember this criteria. Of course, the disease can be generalized, meaning in more than one location or in the whole body, or can be regional in a certain area. We have postmenopausal osteoporosis that is obviously influenced hormonally in a woman's body. Women tend to be a bit more predisposed to osteoporosis because of multiple processes that they undergo, all of them leading usually to extreme periods of hormonal influence or imbalance. Pregnancy is one of them, including the loss of calcium from teeth. So that's a major influencer. The lack of bone mineral density is very important as well, and is always part of the process. Secondary osteoporosis, I don't think there's a lot to explain here. Something else is causing that imbalance in calcium. I think that the content on slide 78, 79, 80 is pretty simple. So let's go on to osteomalacia. It's a metabolic disease that includes the delayed maturation of the bone, mineralization process. Obviously, this is going to affect its stiffness and stability, and it's going to create a weaker bone. The bone volume is unchanged, but the inside process causes that the imbalance increases soft bone content more than stronger bone or compact bone content, meaning that the bone from the inside is softer. It looks normal from the outside, but it's not from the inside. What else? You can see that the lack of vitamin D is a major cause of this condition, this pathology, and of course, vitamin D's production is tightly connected to the lack of sun or sunlight. What else? We can talk about renal causes to the disease. Obviously, the renal system, as you heard of already, is very important in the balance of ions and all kinds of substances that are important to function. The chances that you have a renal problem and other systems are not going to be affected are very slim. You can see a fear of walking because the bones are so weak, they can just snap. So that's very problematic. PDB. We're talking about a bone that is in a metabolic imbalance. So it's hyperactive. So what happens to the bone is it's constantly remodeling itself by a higher rate than normal. It's breaking down itself and building itself constantly. And that means that there's never a period where you have stable tissue. Even if it's healthy tissue, no reason to tear it down, to catabolize it, to reabsorb it. The bone is still doing so. This takes a lot of energy. It never leaves you with mature bone, and obviously that causes a weakness. The bones are bigger than normal because the imbalance goes towards building. So you have the bottom line is bigger bones that are also softer, and that is a problem. We believe that up to 30, or it's suggested that up to 30% of the cases are genetic. The mechanism is still idiopathic. We don't know exactly how it happens. Then, of course, when you're talking about an abnormally big bone, it's going to influence the environment. It might hurt neighboring tissues. Now, who can enjoy, so to speak, profit from a metabolically imbalanced tissue? Let's think about it. I hope right now you're just shouting out the word cancer. Cancerous cells they flourish on metabolic imbalances. You have an area that's lost control, lost supervision, is high on energy, all over the place, so to speak, which is not a professional term. And who can take advantage of it? Tumors. Tumors and cancerous tumors. So obviously it is a cause for tumors and cancers. Then we have osteomyelitis, basically caused by bacteria that leads to bone infection and disease. We can talk about, the infection being influenced from outer factors outside of the tissue or within. So that's the exogenous versus endogenous. Nothing new about the idea. You have an infection. Did the infection originate from inside the bone or from outside the bone? Obviously, if it's from outside of the bone, if you ask me, that's worse, because that means that you have bacteria that are causing infection, not only from inside the bone, it's already out there. So you probably have an infection in multiple areas. And in this case, we're looking at the result in one location. Then we can talk about infections or an inflammation that it originates mainly because of sickle cell disease, which is hematogenous, meaning it originates from the blood. So that's part one. I'll be preparing a video for part two. Stay tuned.